EBUS or endobronchial ultrasound. It's a bronchoscopic technique that uses ultrasound to visualize structures within airways, lung and mediastinum. It's minimally invasive and it can be done on OP basis with local anesthesia and moderate sedation. Coming to our topic, there are basically two types of EBUS. One is the radial and convex probe EBUS. Now what you should know is both these probes, they have a transducer as well as a processor. The function of transducer is it produces and receives sound waves. The processor, it integrates the reflected sound waves. Now depending on the absorption and scatter of tissue interfaces, the processor, it generates ultrasound images. Before we discuss any further, you should know two important roles of ultrasound. One, it works on the piezoelectric effect. And second, the depth penetration of the tissue increases as the frequency decreases. Now what you see here is a convex EBUS probe. The advantage is that it allows real-time imaging and thereby help in the sampling of tissue. As we said, there is an ultrasonic transducer at the distal tip producing a frequency of 5 to 12 MHz. Thereby we can achieve a tissue penetration up to 5 cm. This convex EBUS probe has the capability of displaying B mode, that is the brightness mode, as well as the color Doppler mode. Convex probe EBUS, it can scan 90° perpendicular from the longitudinal axis as well as a 35° forward oblique video view. This is a working channel of 2 mm through which 22 gauge needle can be used to aspirate of the target lesion. A balloon sheath is present over the transducer which is to be inflated at the time of procedure with water. In short, we have a 35° video view to visualize the mucosa as well as the bronchus, and a 90° perpendicular view of ultrasonic image to visualize the underlying structures of blood vessels and lymph node. For an example, this is the CT image of a patient showing enlargement of 4R lymph node, which is the right lower paratracheal lymph node. When you pass the convex EBUS probe, and after which the balloon sheath is inflated with water, in the Doppler mode, you can see the enlarged lymph node as well as the underlying vessel, in which here it is the superior vena cava. Now, the advantage is that you can do the real-time aspiration using a 22 gauge needle without injuring the underlying vessels. So friends, I'm closing this session for now. Thank you. And in our next session, we'll be discussing regarding radial probe EBUS and the indication for EBUS.